Okay, so good morning, everyone. Thank you so much for joining us today. We're very excited for this morning's SHERPA webinar, where we're going to be discussing the technical, ethical, and social implications of COVID-19 contact tracing apps. And so we're going to be having some presentations from Alexey Kirichenko, Kevin Macnish, and Renate Klar. And after the presentations, we'll have a bit of time for some Q&A. And for the Q&A portion, due to the number of participants, we're just going to ask that you please type any questions that you have into the chat and direct them to a particular speaker when relevant. And before we get started, we just ask that you please have your microphones muted if they're not already and your cameras turned off for the duration of the presentation. This is just to minimize any distractions. And please note that the webinar will be recorded. So I'd like to introduce Kevin Macnish, who will introduce the webinar and get us started.
Thank you, Nuala. So as Nuala said, welcome to the webinar. I'm Kevin Macnish, and with my colleagues Renate Klar and Alexey Kirichenko from the SHERPA project, we're going to be presenting the SHERPA perspective that we have on the COVID tracing apps. Next slide. Next slide, please. Well, the next slide is coming up. SHERPA is a European Commission funded Horizon 2020 project looking at the ethical and human rights implications of artificial intelligence and big data, which collectively we've termed smart information systems. The project consists of 11 partners across 7 countries around the EU, including people from industry, small and medium enterprises, and from academia. Next slide. The goal of what SHERPA is about is essentially to try and find the ethical and human rights implications of these smart information systems, or SIS, over a 3.5-year project. Bringing us together, we've got collective specialisms in philosophy and ethics, social sciences, human rights law, cybersecurity, governance, arts, and standards. And the particular approach that we've taken to try and look at these is by understanding through a collection of case studies, future casting scenarios, guidelines, and policy recommendations as to where Europe should be going with its understanding of and regulation of smart information systems in the future. Now, while, of course, the whole coronavirus scenario was not on our radar back when we started the project in 2019, it has nonetheless become a very major issue, a very real part of our lives, and part of that has been the testing and tracing apps, which, although they don't, strictly speaking, use artificial intelligence, nonetheless come within the general purview of what we're talking about and what we're interested in. So next slide. So as an overview of the next hour, we will start off with a talk about the technical aspects by Alexey from F-Secure. Then I will speak about the ethical aspects, particularly focusing on questions about proportionality of these apps, and I'm from the University of Twente. And then Renate will be speaking about questions around voluntariness, and Renate is from UREC. Finally, we will end, as Nuala just said, with question and answers. Each of the talks is about 15 minutes long, and so that should give us approximately 15 to 20 minutes for question and answer at the end. So thank you again for being here. I hope that you find the next 45 minutes to an hour instructive and helpful, and do feel free to ask any questions that come to you during these talks. And with that, I will hand over to Alexey.
Hello. Thanks very much, Kevin. I hope you can hear me well. Anyone, please confirm? Okay, very well. Yeah, I'm Alexey. I work at F-Secure, which is a cybersecurity provider of services and products. We do a lot of cybersecurity, but we do also a lot of artificial intelligence. So let's return still to the title slide. Talking about technical considerations, I wanted to start with a couple of remarks. The first one is that in the domain, there are really many trade-offs. And because of that, primarily because of that, it's not easy, it is not always easy to say what a good system is for contact tracing. Sometimes you can say that certain things are really bad, but in many cases, it's a matter of preferences and matter of trade-offs. So hard answers in this domain are usually quite difficult. And the other remark is this domain of contact tracing, it's really a very fast-paced one. There are really many versions. They change often. They've been developed on the fly, essentially. And because of that, one has to be careful making any hard statements, because things which were correct yesterday may not be correct today. So I'll try to be careful in that sense. So let's now go to the next slide. As a very informal introduction, let's start with defining the purpose of mobile contact tracing applications. Very roughly, very informally, this is like a recommender app in a way, not based on artificial intelligence necessarily. In most of the cases, it's not, but it's kind of a recommender app. So it can advise contacts of an infected person to take some measures. And then those measures are obvious. You just either self-isolate or go for testing or contact your health department or something like that. Of course, one of the main targets of this is to break the chains of transmission of COVID-19. But of course, there could be some other goals as well. Whether those goals are enabled by specific application implementations, that's a different question, but some of such goals could be, for example, understanding how the situation, how the landscape is developing for the health authorities, for the authorities in general. There could be some other goals as well. And it, of course, depends heavily on what sort of information is collected, how that information is analyzed and presented. Yeah. And it's important to emphasize that the mobile contact tracing is not really to replace the conventional tracing. The conventional tracing is in place, and it's already a trade-off between privacy of individuals and benefits to larger groups, to the society. And the mobile contact tracing, those apps, they are essentially to complement the conventional tracing and to cover the blind spots. In the conventional contact tracing, it's very roughly, if someone is infected, that person is interviewed by health authorities. They try to track down that person's recent contacts. And then they approach those recent contacts and again advise them to take certain measures. And of course, such an approach inevitably has blind spots. We forget things. Some of our contacts happen to be very accidental, and we are not even aware about them, and all such things. So mobile contact tracing is essentially just to augment, to cover blind spots left by the other means of contact tracing. So let's move to the next slide. And of course, one of the first questions that one has to consider thinking about mobile contact tracing, what would be the evaluation criteria? What makes a specific application, a specific approach, a specific system useful for the purpose? There was a nice citation from the Science magazine saying that we will have to define success. We will have to explain to ourselves what it means that a specific application does the job very well. Of course, as I mentioned, there are many trade-offs and there are many criteria which we have to take into account. We start with accuracy. Of course, what we expect from a good application it has many correct detections in the sense that it really helps find many contacts of infected people. So it just brings actual value in identifying potentially infected people. And the counterpart of that, we wanted to have low false positive rate. So we don't want to see a lot of detections which are completely irrelevant, because they, of course, confuse people, take time, take resources. We definitely don't want to see high false positive rate. And what it means many and what it means low, those are difficult questions. The thresholds for goodness, they are not very easy to define. We have some intuition. Some of the authorities, they propose specific numbers, but in general, those are not very easy to define. And of course, with accuracy, there are inherent limitations. After all, mobile applications for contact tracing work only if on the both phones of two people who meet, there is such an application installed. And that application is either by the same provider, or at least the two versions can talk to each other. So it's very important that really many people, a significant share of the population, installs those applications. Without that, of course, nothing will work at all. And of course, there is also the counterpart. Even if the application works well, the people still have to act upon those recommendations to contact public authorities or take self-isolation. So of course, we have to consider the technology as an enabler, but there are many other things which will be discussed later today, which have to be taken into account and which are critical for the success. The next bullet on the list is acceptable security and privacy risks. Because we have to collect data, we have to share data, we have to process data, definitely certain security and privacy risks come into play. And when we say acceptable, that's again a very vague term. What is acceptable is again very case specific and very personal opinion specific. We also have to think about security assumptions. Specifically, who are we concerned about? Who is sort of an adversary in our case? Is that malicious people who would like to cause harm? Is that the authorities themselves? So those are questions that need to be answered when we consider what are the security and privacy risks and what makes them acceptable or unacceptable. Apart from security and privacy, there are, of course, very simple things. The costs operating such applications, operating their backend systems, operating the data analytics involves costs. That's data transmission, data handling, a number of other things. And of course, we don't want those costs to be prohibitive. That's very important. Utilizing those applications on your mobile phones and utilizing their analytic systems in the backend, that really consumes resources. We would like that resource consumption to be acceptable. For example, we don't want those applications to completely drain batteries of our phones in very short time. We want those to be very modest from the energy consumption point of view, for instance, and also from the network traffic point of view as well. So there are multiple criteria of success, and we really have to be very careful when we say that a specific version of application is better than some other specific version of an application. Evaluating good and bad applications, comparing applications is not easy. Many things have to be taken into account. And again, preferences can vary because you have a multi-parameter target function, essentially. Of course, different parties, different individuals, they will have different preferences. Let's move to the next slide. So very briefly looking at some challenges and risks on the technical side. As we mentioned, accuracy is very important. And an important part of providing accurate notifications is distance estimation, because this is more or less how we define what contact is. Two individuals happen to be close to each other, and because of that, the chance of transmitting the disease was relatively high. Distance estimation is not a simple task. There are multiple technologies that can be used for that. Most notably GPS, Global Positioning System, and BLE, Bluetooth Low Energy Radio Signals Exchange. And of course, they have some limitations to their precision. They are not perfectly precise. And there is quite a bit of research spurred particularly by COVID-19 crisis, how to improve the precision in distance estimation. There have been some recent advances. Just as an example to mention, there was, for example, an application called Novit by Carnegie Mellon University researchers. For example, in addition to Bluetooth Low Energy, they also use the ultrasonic technology. And they measure some timings of how ultrasonic waves come from one phone to another phone. And by that, they try to figure out the distance with a higher precision. So there are multiple approaches. There are some challenges related to security and privacy. Again, of course, there are many things that people may want to keep personal, not to share with the others. Their COVID positive status, their social interactions, their identity, many such things. And of course, there are typical security risks. A malicious person, for example, may want to send illegitimate, fraudulent exposure notifications. And the consequences of those, if they are not recognized as fraudulent, will be quite bad, clearly. One more thing, which is not completely technical, but partially technical as well, is how clear our communication about capability of such applications is. Because if it's not, then people may have a poor understanding of how the applications work, and they may have false hopes. They may expect that the application is perfect and trust it blindly, and of course it's not. So it's very important to explain in simple, understandable terms what such applications are capable of and what they are not, what the limitations are for this. Let's please move to the next slide. There are multiple approaches of how contact tracing applications are implemented. And I want to spend maybe a couple of minutes on approaches based on Bluetooth. Approaches based on GPS, they have some problems. They have some problems with precisions. They have some problems with security and privacy. So in many cases, implementers, they opt for Bluetooth-based approaches. Which is essentially proximity-based tracing. You don't really need to know absolute location of individuals, of their phones. And the main idea there is that mobile phones of the users, they broadcast and record Bluetooth signals, which are just radio signals. So an important question in how we sort of evaluate those technical approaches is what exactly we need to share with the authorities in various cases. There are centralized approaches, which essentially means that everybody has kind of their ID in the system, and positive tested users, they just have a list of those Bluetooth identifiers that they observe in their proximity, and they share those lists when they get positively tested. They share those lists with the authorities. And then the authorities, the central notification service, notifies those who may be impacted by this. Of course, from the privacy point of view, this is relatively invasive. There are multiple attacks which can be mounted. There is quite a bit of information which can be correlated together, and certain things can be figured out. So centralized approaches definitely have some drawbacks on the security and privacy side. They probably have some benefits on the effectiveness of notification side. Because in principle, when the authorities know for sure who to notify, then maybe they can make those notifications stronger and make sure that people who might be impacted, might be infected, they will really act upon those notifications. Then there are decentralized designs. Those are apparently most popular in actual applications. And this simply means that instead of sharing the list of observed identifiers, like saying who you met with, the users, the positively tested users, they simply transmit to the central service some randomly generated token, or they even add that token to the public service themselves. And that token is sufficient for the other users of the application to verify whether they happen to be in proximity, whether there was a contact with someone who was positively tested. So that approach is, from the privacy point of view and security point of view as well, is probably better if properly implemented. Of course, there are many flavors. Well, then of course the central authorities, they know very little. And of course, one of the assumptions here, they are not actively trying to learn more. So if they have the information provided by the users, then of course this is one story, and they can use with that information whatever they deem necessary. But in this decentralized approach, they simply don't have this information unless they really try to actively attack the users. We assume that that doesn't really happen. It is possible not to have any identifiers for the users at all. The third potential approach is when you trace only encounters. That can be based on very simple cryptographic functions. And in such a case, an infected user, they don't really have any identifier, any even randomly generated token, but they have a list of the encounter IDs stored on their device, and they can just publish the entire list. And that list can be verified by the other users, and they can check whether they were in proximity with the specific positively tested user. So from the security and privacy point of view, this probably is the best possible approach. It has some problems with resource consumption. It has some problems with how much information you have to communicate. Whether this is better or whether this is worse, again, a matter of opinion. Let's move to the next slide. So one thing that definitely should be mentioned in connection with contact tracing is the Google Apple exposure notification. That's an open source development. It's a framework and protocol. Was introduced in May, probably even a bit earlier, maybe in the end of April, but in May it became a part of actual mobile phones. It's implemented by the main vendors, so it's at the operating system level with all the benefits of that. So it's good from the resource consumption point of view. It doesn't abuse any interfaces and APIs and functionality of mobile phones and their operating systems. It's quite efficient from the performance point of view and all that. It's based on decentralized design, so location data is not used at all. And Google and Apple, they actually published their risk analysis and how they try to mitigate those risks. This is, of course, never perfect, but at least they took a very serious effort to do that and make it very public what are the risks and how those risks they try to address. We already see that there are some publications, some scientific papers, which essentially try to extend the Google Apple exposure notification system by making it better. But trying to make it better, sometimes they break the original assumptions and they break, for example, the security model. They say, if we just knew a little bit more, and that little bit more happens to be information which was not supposed to be shared at all. So it's again a clear trade-off between security, privacy, utility, precision, and many other things. Let's move to the next slide. I'm not going to very carefully go through this basic checklist, but there are some things on the security and privacy side which could be some sort of like health check for how well a specific application or specific system approaches security and privacy issues. And of course, the points on this list, this is the list, by the way, that F-Secure communicated to Finnish Parliament a few months back. Those are almost self-evident. They are nothing fancy, but of course, there are plenty of applications which do not respect some of those bullets. And please, next slide. So this is the last slide, and this is probably the most controversial one. As I mentioned, things change very rapidly. So what is said here may not be true anymore. But when certain countries make their choices how to implement mobile contact tracing, some of those choices, well, they lead to a lot of debate and a lot of discussion. Chinese government, by claims, they simply track locations of people, and this is mandatory for accessing certain places. So it's probably as invasive as one can think of. Whether that's a good approach, yeah. We know that phone location data is used in applications, or was used in application in a number of countries and a number of United States. Again, well, they probably had some reasons of doing that, but maybe those reasons are not high enough to justify the use of phone location information. In the UK, they had the initial version of application, which was not really based on the decentralized approach. It was centralized. Of course, they didn't use GAEN at that point, this Google Apple Explorer notification. They abandoned that initial version, so they went for the GAEN model. In France, they say that GAEN API does not provide sufficient information for the authorities. And because of that, they, I think, still today continue utilizing application, which is their own invention, which in a way technically abuses some of the mobile phone interfaces. Well, they use centralized collection of contact tracing data, and they believe this is how it should be done. Right, so at this controversial slide, I'll stop. Thank you very much for your attention.
Great, thank you, Alexey. That's really helpful and a very good introduction to what I was going to speak about on the ethical issues arising from some of these questions. And particularly what I want to focus on is some of the approaches to these technical fixes that are put forward, and to the fact that while the technical fixes, as you say, Alexey, are presented in a certain way, they're not always used in that way. So if we could have the next slide. As Alexey has said, well, where I want to go with this, sorry, is questioning, are we risking too much for the illusion of action with the creation of these slides? And I think if you found Alexey's last slide controversial, then you'll probably find all of what I have to say even more so. So I will go very quickly through how the apps work. Alexey has covered that in detail, which is fantastic. Then I want to look briefly at what we mean by proportionality, and when we say that something is proportionate or disproportionate, what's going on. And then focus it a little bit on what the harms of these apps could be. Alexey again spoke a lot on privacy and security trade-offs. I think there are some other things which I want to throw in there as well, before coming back to looking at this question of false positives and false negatives, and then drawing a conclusion. So if you can have the next slide. So the apps, as Alexey has already said, come in different forms, numerous different forms. They can be centralized or decentralized. The centralized form of the app was used extremely effectively in South Korea. Although they had a very large spike in the early days, literally the early few days of coronavirus hitting the country, they were able to bring that under control extremely quickly. but it meant there was a very high level of surveillance going on among the population through the apps. And generally in the West, people have been unprepared to see governments having quite as much control as that. So we've instead tended to go for mobile phone tracing apps, which rely on proximity and are decentralized. So there's no information that goes back to the government or a central source. The information is largely kept on your phone. But the key thing in both cases is that they deal with the proximity of mobile phones to each other. Now, if you could have the next slide. So in thinking about proportionality considerations, we need to bear in mind that the apps are not perfect. And as Alexey has already talked about the fact that we have false positives, false negatives, and other concerns. But nonetheless, there's an urge to do something. You know, we're facing this major global crisis, and it feels that it would be disproportionate not to use every possible means at our disposal in order to resolve or to respond to the problem at hand. And so what we sometimes hear is people saying that it would be disproportionate to let COVID rage rampant if we can do something, even if that solution is not perfect. Now, in that case, the way proportionality is being used is in the sense of it's better to do something rather than nothing. And it would be disproportionate just to do nothing. However, there's another approach that we could take to proportionality, which would be to say it is disproportionate to let COVID rage rampant only if the apps don't introduce more harms than they solve. That is, proportionality is about weighing harms against benefits and recognizing that these apps could introduce certain harms. So if we could have the next slide. Thank you. So let's look at some of these harms. And again, drawing from Alexey's discussion, there are obviously trade-offs in all cases, and trade-offs particularly between privacy of positive tested individuals and benefits to society. Now, one of the advantages with the decentralized app is that the privacy considerations are taken much more into account than they are with the more centralized version. Even so, though, they may give away aspects of people's lifestyle if you then have to go and get tested. In South Korea, there was a resurgence a while back of the coronavirus, which was located in a district where there were quite a few gay bars, and people had been known to be partying late in the night. So by simply going to be, if your app told you that you had been at risk, then simply going to be tested, still less if you were found positive, and then telling your boss that you had coronavirus in the few days after that event would mean that certainly assumptions could be made about your sexual orientation and about what you were doing, potentially partying late at night in the middle of a crisis. Now, on one hand, you might say, well, yeah, tough, you shouldn't have been doing that. And that's certainly a perspective that some people take. However, there's a problem because public health relies on trust. If you don't trust your doctor to keep your information confidential, then you're unlikely to go and tell your doctor about particularly embarrassing ailments that you might have. And so it's crucial that a sense of trust is maintained within any public health network in order for it to work. So what else could happen from these apps? Well, quarantine is the obvious fallback that happens here. And if somebody decides not to get tested, even though their app has told them that they may be at risk, they might decide, well, rather than get tested and risk my name going into a system which I don't trust, I will just self-quarantine. But then in that case, there may be fear of illness. There will certainly be a reduced capacity to work for most people who can't work 100% at home. Problems of loneliness and isolation. And these are sort of things that we've been seeing already with the lockdowns, but this becomes more isolated when one particular person is told you may have coronavirus. And of course, false alarms can come from this, which you might not have coronavirus. And in that case, if that happens to you on a regular basis, after a while, you're going to say, I can't cope with more lockdowns. I'm just not going to self-quarantine anymore. And eventually economic damage that arises out of that. And that's not just economic damage to you as an individual, but also economic damage to the country, as this happens to, of course, multiple individuals around the country. which has an impact on income and welfare and a longer term knock-on on how we're able to provide healthcare for each other. But there may also be failures of the apps as well, when the apps don't work, when they don't manage to trace people effectively. At the worst case, death, severe illness, mild illness, asymptomatic responses, a variety of ways in which we respond to the virus, which again lead to economic damage and again extend quarantine, where particularly in the UK at the moment, we've got severe lockdowns being reintroduced into some cities as the virus numbers are increasing. So if you could have the next slide. Thanks. So going back to this question about false positives and false negatives, there is, as Alexey said, a certain trade-off. But there's also a trade-off when you have false positives. So false positives, just to remind you, are when you have been told that you might be at risk or that you might have the virus, even when you don't. And with any technical system, there tends to be a goal to reduce the false positives as much as possible, because you want as great an accuracy as possible. The challenge there is that we then run into the problem of what's known as automation bias, which is when the false positives drop below a certain percentage, people think that the app becomes effectively 100% trustworthy, even though it is not. Now, we've seen this happening. It was first noticed with pilots of aircraft. It's also been noticed with operators on automated weapons systems and drivers in self-driving cars most recently. So we know that this happens, that if a computer or an application tells you something and you trust it, then you are typically going to believe it, even when there is a false positive rate. So, but let's see what those issues are. Yeah, can it be that these things can give false positives, or rather, how do they lead to false positives in terms of identifying somebody as being at high risk or likely to have COVID when they're not? Well, remember, these are based on proximity, not of people, but of mobile phones. So firstly, you have to be carrying your mobile phone with you, as does the other person, in order to register that there's a connection. Secondly, it's because you pass within a certain radius of another person who has a mobile phone carrying the same app and who is also registered as positive. Now, you can pass within a radius of another person quite easily, even when they're on another side of a partition or another side of a Perspex screen, or even when you're both wearing face masks. And these are things which the app won't pick up. And the result of a false positive, as I've suggested already, is of course that leads to self-quarantine or testing, which may be embarrassing or awkward for people in different situations. The flip side of that is the false negatives, that is failing to identify somebody as COVID positive when they are. And again, that can happen because you caught COVID from somebody who is asymptomatic, from somebody who wasn't carrying their phone at the time, or a variety of different reasons that are not hard to imagine. And from this, of course, we then get this spread of virus, economic damage, and extended quarantine. So the fact that these apps are not perfect, but my concern is that they might be treated as perfect, could be quite damaging. Now, to come back to the earlier point about, well, surely it's better to use these rather than nothing. That would be the case if these apps were the only approach or the only alternative. But of course, they're not. There are different alternatives that we can explore and that we can examine in an ideal world that would go alongside the apps. But in a world of finite resources are often dropped in order to focus on the development or use of the app. And in the UK, certainly, we've yet to be told how much the development of the NHSX app cost before it was then dropped in favor of the Google Apple app instead. So there are alternatives that can be, and I would argue should be, explored, and particularly focusing on personal interaction with healthcare workers who are properly protected. In South Korea, when somebody was identified as having coronavirus and put into lockdown, they were visited twice a day by a healthcare worker, which helps to relieve some of the pressure of the lockdown. It helps to see a human face that they can then talk to and speak with and interact with. And remember that we are part of a community of other people and that our lives are not being dictated or directed by automated systems, which I think, as I've been saying throughout this talk, is a risk that we find ourselves at. So if I could have the next slide. So the question I started with is, are we risking too much for the illusion of action? Now, it might be, well, it is provocative to talk about the apps as an illusion of action. They're not. But I think the risks that are being brought in there is not in the apps themselves, but in the way that those apps tend to be used when they're integrated into a wider social system. And the fact that people often end up relying on these apps, relying on the technology, rather than seeking other alternative solutions. Proportionality, I've said, can be seen in terms of doing something rather than nothing, but in that case, that is the illusion of action. We're not talking about doing nothing. We're talking about properly extending alternative solutions and fitting the apps into a wider system of application. Something came maybe disproportionate, I suggested, in terms of benefits gained over harms threatened. And I think the harms that are threatened by the apps are significant and shouldn't be undermined. I was reading an article the other day where somebody made the comment on no empirical evidence whatsoever. Well, these apps are saving lives. They must be. It simply stands to reason. So I think, are we risking too much for the illusion of action? Currently, yes, I think we are. And this is something we need to take very seriously and look at not only how effective the apps are, but also how effectively the apps are being applied to society. And I think now, as I hand over to, excuse me, as I hand over to Renate, that's precisely something that she will talk about with questions of voluntariness. So that's it from me. Renate, over to you.
Yeah, thank you, Kevin. Thanks a lot for this bridge to what I'm going to say, particularly about fitting the COVID tracking apps into a wider system. Next slide, please. So there were some risks mentioned of the app, the technical challenges, the possible ineffectiveness in its use, false positives, false negatives, and the problem of the possible unproportionality of risks and benefits. So introducing the app into society, we really have to be careful. We need, that was a bit elaborated by Alexey, an ethical design. I would add, we need some further safeguards and implementation. And most of all, we need to guarantee that the use of the app is really voluntary. Next slide, please. So what does it mean that the app, that its use is voluntary? So first of all, what does voluntariness mean? Very philosophical approach. Voluntariness is a choice that is made in accord with the person's free will, as opposed to being made under coercive influences or duress. We will look into this a bit deeper. So that implies that there are no sanctions or restrictions, that there is no threatening or pressure, and no manipulation, because all this would make the use of the app not voluntary. Next slide, please. So what does voluntariness mean in the context of the tracking apps? Voluntariness is the decision, and this is important in all these steps. Voluntariness has to be guaranteed. Voluntariness is the decision, first of all, to have a smartphone and to carry my smartphone with me. Then voluntariness is the decision as well to download and install the app on the smartphone. And voluntariness is as well the decision to leave the app operating in the background all the time. I mean, we heard a bit about possible security issues. And voluntariness is the decision to react to its alerts and to share the contact logs when tested positive. And as well, we have to be able to change our mind. So voluntariness is as well the decision to uninstall at any time the app and remove the data that has been collected already. So therefore, the app should not be embedded in the operating system of a smartphone. Next slide, please. But this is not enough to be able to decide if we want to use it. We need some information. this is a bit about informed choices. So we need information about the functioning of the app. It was mentioned that the code should be, for example, open source so that it can be verified. And we need to know about which data exactly is transmitted and to who has access to the data, including third parties. Is it really the health authorities, or is it maybe the police department as well? So only when this information is available can users understand to what they are agreeing to and make a well-founded decision. Next slide. But there are further aspects of voluntariness which become important when introducing the app into a wider social context. I mentioned the restrictions and sanctions already, and it has to be guaranteed that people who do not use the app are not restricted or sanctioned in any way. And to give this a bit more detail, let's have a look at China. China introduced very early a COVID tracking app, and almost everybody in China is using it. Well, what happens when you download the app? You have to register with your name, your phone number, your address, and your national identity number. So you're very clearly identified as a person. But this shall not concern us here. We have to go on and give more information about the health status when using the app, the travel history, and contact with COVID-19 positive people. And out of all this partially very sensitive information, a color code of green, yellow, and red is assigned to each user. Green, you probably know this, means you're healthy. Yellow means you have to go for 1 week in quarantine. And red implies 2 weeks of quarantine. And this has very important implications for voluntariness. You can say, of course, well, I can download the app or not. This is true. So pro forma, it's voluntary. But of course, it's not in a practical way if you're excluded practically from societal life. Because in China, you have to have a green code when you want to travel, when you want to use public transport, when you want to enter a restaurant or a shop. So if you decide not to install the app, you're practically 100% excluded from social life. Well, the same would go if the app would be made mandatory at the workplace, and peer pressure might play an important part as well. It can be so strongly expected that you use the app that it's almost compulsory. As well, there are some interesting ways of nudging. For example, I think in the French Parliament, the discussion of the ease of the lockdown was coupled with the discussion of the introduction of the tracking app. And of course, people waved it through because they wanted the lockdown ending. So this would be an example of nudging, for example. Okay, next slide, please. So what could be done about it? A bit has been said about this already. Ethics by design was mentioned, voluntariness and security and privacy can be designed into the app up to a certain degree, but I'm not sure if this is enough. I think the introduction of COVID tracking apps should be treated like a social experiment and should more like be considered as a sort of controlled trial with safeguards. And a critical periodical review of the consequences would be needed as well. So in Alexey's presentation, it was mentioned that security and privacy, because things are changing so rapidly, have to be reviewed for the app. And I think we have to monitor for the society as well, is the app effective and what consequences does it have? In particular, we have to check what possible harms does it to people who take part in this social experiment. So maybe some of the citizens that decide to use the app need to be protected to guarantee proper use of the data. But maybe people that do not take part in this experiment and decide not to use the app have to be protected as well. For example, it's not impossible that the tracking app, if the pandemic gets really serious, could be used in Europe as well as an entrance ticket for restaurants or shops and so on. So we have to think about as well, do we need further safeguards to prevent this? Because this could exclude the elderly from social life if they do not have a smartphone, for example. So we might need additional measures, maybe even in the form of law, to guarantee that the introduction of the app into society is ethical and safe for all. So next slide, please. I'm at the end and I would like to ignite a discussion. So I'm getting even more provocative. I'm saying we have high risks, we have high cost. There was talking about resources before. We have the possibility that we have to introduce further safeguards to guarantee an ethical use. And this is coupled with a not too high effectiveness of the tracking apps, and at the moment, a low uptake. People do not seem to want to use this app voluntarily. And well, I think I made a case for we have to use it voluntarily. So having a look at these points, I leave it up to you with the question, is it really worth it? You decide for yourselves. Thank you for your attention.